two harmful substances found in legumes can lead to severe medical conditions. These are the components in Kesri dal responsible for causing lathyrism and the hemolytic factor in Vicia faba associated with the disease known as Favism. Lathyrism is a paralytic condition that primarily affects the lower limbs. This condition is more prevalent in males than in females, and it usually does not result in a full recovery. The ailment has been documented since ancient times, with references to it in early Indian medical texts. Significant outbreaks of lathyrism have occurred in various regions, particularly among below poverty line families who rely heavily on Kesri dal as a food source. When other crops fail, this legume tends to thrive, forcing economically disadvantaged individuals to rely on it for sustenance. However, lathyrism typically develops only when there is high consumption of the dal, around 300 grams daily, insufficient inclusion of cereals in the diet, and prolonged consumption, over 6 months. In lathyrism, the toxic substance interferes with the normal formation of collagen fibers in the connective tissue. The disease can be prevented by maintaining a reasonable dietary balance between Kesri dal and other food sources, replacing it with alternative pulses when possible. Favism. Favism is a condition characterized by hemolytic anemia, and it is primarily found among individuals residing in the Mediterranean region or of Mediterranean descent. In severe cases of favism, death can occur within 24 to 48 hours after the onset of symptoms. Children are more susceptible to this condition than adults. If the affected individual survives the acute phase, recovery typically takes about 4 weeks. Favism is triggered by the consumption of broad beans or exposure to the flower's pollen. Those affected by this condition have an inherited biochemical abnormality that impacts the metabolism of glutathione in red blood cells. This abnormality results from reduced activity of the enzyme glucose 6-phosphate dehydrogenase. Individuals with this abnormality have red blood cells that are more susceptible to damage and destruction when exposed to certain drugs, such as sulfonamides. This complicates the treatment of infectious diseases in individuals with this condition.